Welcome to Paul's Heart. I'm Paul, author of the book, Paul's Heart, Life as a Dad, and a 35-year cancer survivor, available on Amazon. I'd like to take a moment and talk to you about something that came across my news feed today. A cancer patient dealing with something called pre-treatment anxiety, something that I used to call 35 years ago anticipatory nausea, where you have an upcoming treatment and you just get so hyped up about it, so anxious about it, that you get to the point where you make yourself nauseous, quite sick, actually. It could be as simple as even just driving by the medical facility enough to make you throw up. Back then for me, because we didn't have all kinds of medications to help us deal with these anxieties and nausea and things like that. But what would happen for me with the particular chemotherapy regimen that I got, one of the drugs I was actually able to taste. And what that did to me as my second treatment approached, and before I even set foot in that building, my mind played the most horrible trick on me, causing me to actually be able to taste that chemotherapy drug. And I hadn't even walked into the building yet. And this happened every time I went for treatment. And of course, it would make me nauseous. And I would explain to my chemotherapy nurse that I was feeling quite nauseous, and she just kept a bag in a basket ready for me if I ever needed it. Fortunately, I was able to, be calm enough that I would just wait for the nausea to hit once the actual chemotherapy went its course through my veins and I had gotten home. But the thing is, you have to realize this feeling, this anticipation, this anxiety is normal. And if you're someone going through this right now with your own treatments or even scans, it's okay to feel this way. It's normal. It's expected. But you don't have to put up with it. Now, again, as I always say, I'm not a doctor. I'm a patient advocate. I'm somebody who's been there, done that. What you can do, and there's absolutely zero shame in this, is ask your oncologist for something to help. And it could be as simple as a Valium. It could be Ativan. If you have insurance issues that they don't feel it's necessary, so they're not going to pay for it. If you want to go with the generic drugs, which are much less expensive, that you could pay for them in cash. Those are drugs like diazepam, lorazepam, or Xanax. But you can be prescribed something that can help calm you, and they do work. That it helps your mind settle down as you head into those next treatments. But you don't have to feel this way going into these treatments. The anxieties, the anticipatory nausea, they're all very real, but they can be helped. All you have to do is be your own advocate and ask for that help. Until next time, this is Paul's Heart.